Hi there, my name is Dr. Shoshany. I'm a chiropractor and I practice in Manhattan for over 20 years. And today I want to talk about a new piece of equipment we brought into the practice. It's the Cox 8 Force Table. It's Dr. Cox's latest table, and it's the most advanced table. What's unique about it, it's hooked up to a computer, and it gives the doctor a lot of patient feedback, how much force your hand is using, how much of an angle you're using, and what's nice about it, it's measurable and reproducible. So this is the latest piece of equipment we added to the office. And the reason I added it to my office is because some patients really respond better to less care, less chiropractic adjustments, and more Cox flexion, distraction, opening up those facets. This treatment is reserved for people that have cervical disc herniations and or cervical radiculopathies, meaning pain down their arm into their fingertips. Patients that would otherwise consult with neurosurgeons for surgery or get cervical epidurals. So it's very gentle, very specific, and we get excellent results with patients that are suffering with cervical herniated discs. So what's unique about the Force table that's unlike any other chiropractic table on the market is it has transducers which measure force. That's why it's called the Force. So when the patient is laying on the table, it gives the doctor a lot of feedback, how much their hand is pushing down, what angle they're using, how the patient's tolerating the treatment. So it gives us a lot of information, and we could measure it so we could see if the patient was able to get more flexion or more extension than the previous visit, so we could chart patient progress when we go through care. Patients that have extruded discs or non-contained disc lesions could safely get treated with this chiropractic method without amplifying their symptoms. So sometimes in the past, if somebody has, let's say, a really bad herniated disc, a side posture adjustment or cervical adjustment, it would amplify their symptoms, maybe flare them up a little bit. What's nice about this is super non-invasive. So what flexion distraction does is it takes pressure off the discs, takes pressure off the very delicate and sensitive nerves, and allows the tissue to rehydrate. And rehydration is important because that'll allow the area to start healing properly. So some of the common conditions and people that would seek out a Cox practitioner are people that have radiculopathies or nerve pain, either sciatica down their leg or radiculopathy down in their arm into their hand, possibly leading to things like carpal tunnel syndrome. We're also dealing with facet syndrome, and we're also dealing with people that have degenerative disc disease and people that have acute pain. So anyone really that would seek out a chiropractor would respond well to Cox flexion distraction. We had a recent patient come in with an extreme sciatica down his right leg all the way into his heel, did not want surgery. We started with Cox flexion distraction and combined lumbar decompression on a DRX 9000. What's great about the way we practice is we have all these incredible tools, but we also have incredible practitioners like the physical therapist that once the patient is mobile and is less leg pain, we're going to work on developing strength in their core. So the integration of chiropractic care and physical therapy and the ability to refer to medical practitioners when need be, provide patients with an excellent experience. Yeah. And that's what sets our practice apart from other practices, because it's an integrated practice. So not just chiropractic, not just physical therapy and medical care, but all three combined, all the disciplines working together to get the patient better quick. So yeah, if you have any questions or comments or concerns, please feel free to subscribe and or email me if you have anything that you specifically want me to talk about.